Good morning everybody. Today I am going to talk about gallbladder diseases, gallbladder stones and medical and surgical management of gallbladder disease and stones. I am Dr. Mohan Rao, Senior Consultant General and Laparoscopic Surgeon in Chennai. So very commonly I come across these gallbladder stones. Either the patient comes with symptoms of gallbladder stone diseases, or they will come with a report of stones which they have incidentally found during master health checkup or screening. So let me briefly talk about the different gallbladder diseases. The commonest gallbladder disease which we see in more than 80% of the patients are stones. Then you have something called as polyps in the gallbladder, and then you have a very rare condition of cancers of the gallbladder. So we will talk about the very common ones, that is the gallbladder stones. Now basically there are 2 or 3 varieties. Let me just brief you on one of these. We have gallbladder infections, which is due to stones in the gallbladder, what we call as acute cholecystitis. That is, the patient presents with abdominal pain, upper abdominal pain on the right side, sometimes associated with fever and vomiting, and this is an acute case where the patient needs to be investigated, and the symptoms are, as I told you, very severe pain, vomiting and fever. And the second variety is not so severe. They have pain in the upper abdomen, they have bloating of the abdomen, they eat very little and then they get fullness, there will be a lot of belching or burping. That is called as chronic cholecystitis, which also requires surgical management. Now what is the purpose of this gallbladder? Many people ask. I will come to that a little later. Let me tell you about what do you do when a patient comes with the gallbladder stones. If the patient comes with the symptoms as I already mentioned, then we need to do an ultrasound of the abdomen and blood tests. Ultrasound will show you the presence of stone in the gallbladder with thickening of the gallbladder wall. That means when there is thickening of the gallbladder wall, that means there is infection, and the cause of this infection is the stones. There may be a little bit of fluid collection around the gallbladder, and this is called as acute cholecystitis. Sometimes you may have asymptomatic stones, where the patient does not have any symptoms. So this happens very commonly when, for instance, let me tell you, if you take about 100 people and do a random testing for scans, ultrasound if you do, you will find 20% of the general population will have stones, and they don't create any symptoms. They are called as asymptomatic stones, and they live with it. Now these patients, do we just leave them alone or do we treat them? I'll come to that a little later. Let me just go back to again when I was talking about the investigation. I said we need to do ultrasound. If we find there is stones, it is mandatory we need to do what is called as liver function test, LFT. That will show the impact of the stone on the liver function. The liver function could be deranged, and which requires further investigations. Now before we start treating these patients with acute cholecystitis or chronic cholecystitis, we need to do a test called as MRCP. It's a specialized scan for liver, gallbladder and pancreas, which will show us the entire structure of the gallbladder system, the biliary system, presence of stones, one or more, and the impact of this on the liver and pancreas. So it is a must before we operate to do an MRCP. Now when we do an MRCP, we find that there are stones, and it will also tell us whether the stones have trickled down. See, there is something called, what we call a tube or a duct, what we call cystic duct from the gallbladder, which carries bile from the gallbladder into the intestines. Now one of the stones can trickle down and block the tube, and these patients can develop jaundice. Then the treatment plan completely changes from just being operating to we need to do another procedure called as ERCP, that is the endoscopic procedure, where we have to remove the stone using endoscope, after which we do a surgery and remove the gallbladder along with the stones. Now many patients ask, why should you remove the gallbladder? Why can't you remove the stones? It is not like kidney disease where you remove only the kidney stone, where the kidney is retained. Here the gallbladder is non-functioning. It is of no use. We have to take it out. Now, I was just talking about asymptomatic stones. There are quite a few patients who have stones in the gallbladder. They have no symptoms at all. Do they require a surgery? Yeah, the point is, you have different sizes of stones, starting from 1 millimeter, 2 millimeter. Sometimes it will be just grains or sludge, or sometimes as big as 2.5 centimeters, that is 25 millimeters, or even more than that. Now, if there is no symptoms in these patients and the stones are very small and the patient is not a diabetic, you do not have to undergo any operation. If the patient is asymptomatic, stones are small, not a diabetic, no need for surgery, and you have to screen every 6 months by ultrasound to see if the stone is becoming bigger in size. But if the stone is more than 1 centimeter, any stone more than 1 centimeter, if the patient is not a diabetic, it is better to operate, because if stones are more than 1 centimeter, the gallbladder is totally non-functional and there is no point keeping the stone and the gallbladder there. Third point I have to tell is, if the patient is a diabetic, patient has no symptoms, irrespective of the size of the stone, we have to remove the gallbladder with the stones. So, diabetes is the culprit here. If there is diabetes, surgery is mandatory for patients with or without symptoms, irrespective of the size of the stone. There is one more condition called as gallbladder dyspepsia. That is, patients have got symptoms similar to that of gastritis. What we commonly, the patient comes and says, I have gas problem. So, they have similar symptoms of fullness of the abdomen after eating, heartburn, belching, burping, discomfort in the abdomen, inability to eat much. So when you investigate these people doing ultrasound, you may find stones in the gallbladder, and that could be the cause of these symptoms, but there is no infection in the gallbladder. There is only stone, gallbladder looks normal, there is no thickening, no fluid, no edema, no infection, but they have symptoms. This is called as gallbladder dyspepsia, and the cause of the symptoms is not gastritis but gallbladder disease. So these patients also require surgery where you remove the gallbladder with the stone. Now, what kind of surgery you do to these patients? There is something called as laparoscopic surgery or laparoscopic cholecystectomy, that is removal of the gallbladder using the laparoscope. I am sure all of us know about laparoscope, where we don't cut up on the abdomen fully like in the older days. We just make 4 small holes in the abdomen. 2 of them are 5 millimeter and 2 are 10 millimeter, through which the surgical instruments in the camera is introduced. So the dissection is done and the gallbladder is removed. The advantage of this kind of laparoscopic surgery is that the minimal stay in the hospital, recovery is faster, pain also is less, because the surgical injury created by the surgeon is very minute, 5 millimeter and 10 millimeter instead of the conventional 6 to 8 inches incision. So almost all patients, whether it is acute cholecystitis, that is acute infection of the gallbladder, chronic infection of the gallbladder, or any other complications of the gallbladder disease, can be dealt with laparoscopic surgery. Having said that, you must also remember that when you go in to the doctor for a laparoscopic surgery, you must be ready for conversion into open. Sometimes, that is about very less than 1%, very rarely, there will be difficulty in dissection if there is severe infection, the tissues are very friable, there is a lot of edema or swelling of the gallbladder, in which case dissection becomes very difficult, and it is ideal that you convert the laparoscopic surgery into open surgery for the safety of the patient. Ultimately, safe surgery is more important than just doing a laparoscopic surgery. So if there is a difficulty and the surgeon is unable to proceed beyond a certain point, he will convert it into open surgery. It's very rare, this kind of conversion, but you have to consent for a conversion also. And another disease of the gallbladder is polyps. Polyps are small swellings seen in the gallbladder wall. These are usually, they do not present with any symptoms. They are found during checkup. When you do a mast checkup, you may find in the ultrasound there will be small swellings in the gallbladder. If the swelling is less than 3 millimeter in size, just 1 or 2 of them, you don't have to do anything. Just do a screening every 6 months, see if the polyp is growing in size. But if the polyps are more than 5 millimeter or there are many polyps, then you have to do a cholecystectomy, that is laparoscopic removal of the gallbladder. Now, why do you want to operate on these when there is no symptoms? The reason is, it is possible that over a period of few years, these polyps may change, may undergo a transition to a malignant. Malignant means cancer. There is a possibility, not that it will happen, there is a small possibility that benign, that is non-cancer polyps which you see now, may become cancerous over a period of years. So, if you see multiple polyps, large polyps, more than 5 millimeter, it is definitely an indication for removal of the gallbladder along with the polyps. So, this is what I want to brief you on gallbladder diseases. For further questions, you can contact the surgical department, Apollo Spectra Hospitals, MRC Nagar. Thank you. Now, there are a few questions which are commonly asked by the surgeons when they come into my consultation room, and these are the few questions. I have somebody asking me these common questions. Please go ahead.
What is the function of the gallbladder, sir?
Oh yes, this is a basic question surgeons ask when I talk about surgery. Why do you remove the gallbladder? What is the function of the gallbladder? The function of the gallbladder is to store bile. The bile is produced in the liver and it is stored in the gallbladder. Now, for digestion, normally, as you know, there is acid in the stomach. It takes care of digestion of everything that you eat except fat and oil. For digestion of fat and oil, you require bile. So, the moment you eat fat or oil, the bile will get discharged from the gallbladder into the intestines and it mixes with the food and digestion takes place. Now, so it is a storage organ. So, the next question is, what happens once the gallbladder is removed? So, as I told you, the bile is produced in the liver and it is discharged into the stomach through the gallbladder. Now, if you remove the gallbladder, the moment you eat oily food, the bile directly goes from the liver into the intestines. Just to give an analogy, if you want to buy some dress, you go to a store, but if the store is closed, then you need to go and buy it from the wholesaler. You don't have a retailer. It's something like that.
Is it okay to remove the gallbladder?
Yeah, when you're removing the gallbladder, we're removing only the diseased gallbladder, like in cholecystitis or polyp, and these gallbladders are non-functional. They do not serve any purpose once they're diseased. So it is perfectly right to remove it, and it is better to remove it because that will only create troubles if you do not remove it.
Can we remove only the stones?
Yeah, this is another question being asked. Why are you removing the gallbladder? Why not only the stones? As I told you, the gallbladder is non-functional and that is why the stones are formed. These stones are pigment stones formed by bile. The bile is not getting discharged into the intestines. It remains stagnant there, and over a period of time they become thicker and thicker, more and more bile getting deposited. That is because of non-function of the gallbladder. So we have to remove the gallbladder and not just only the stone.
Do all the patients with the gallbladder require surgery?
Yeah, I think I've already answered this question. Not all patients with gallbladder stones require surgery. Meaning, if they have disease, if they have symptoms, yes, but asymptomatic stones, if they are, I'm just repeating it, if they are less than 1 centimeter in size and not a diabetic, there is no need to operate. You can wait and watch. You can do a screening every 6 months. But if they are more than 1 centimeter in size, definitely you have to operate. And if the patient is a diabetic, irrespective of the size of the stone or number of stones, definitely requires an operation, because over a period of time they will develop infection because of diabetes.
Can I have gallbladder infection without stones?
Yes, this is a very good question. Can you have cholecystitis, that is infection of the gallbladder without stone? Yes, you can get it. It is called as acalculous cholecystitis, that is gallbladder infection without the presence of a stone. So you do get this, and in such cases again the treatment is the same. The gallbladder is infected, it has to be removed. Yeah, as we all know, laparoscopic surgery is a modern invention, modern meaning in the last maybe 20-25 years, whereas open surgeries are for more than 100-200 years or even longer. So, laparoscopic surgery has got its own advantages of minimal surgical intervention, minimal injury to the tissues, faster recovery, less pain and lesser complications. Whereas open surgery, the longer stay in the hospital, not that laparoscopy, open surgery is laparoscopy is not an alternate for open surgeries. Open surgeries in gallbladder disease, as I told you, is done only when at a point when you cannot proceed beyond a particular point because of either very severe infection, friable tissues, or unable to dissect, or there is too much of bleeding. Then we need to convert and open, because as I told you, safe surgery is the ultimate goal and not just doing a laparoscopic surgery. Thank you very much.